Hey, you guys. I'm going to wait a second and see if anybody hops on so I can talk to as many people as possible. So I'm going to share with you in a few minutes what I'm going to talk about today. But you guys know how I am doing this tips and tricks for people with PCOS all month long. So I'm going to continue that because it's National PCOS Awareness Month. Shout out to all my PCOS sisters out there. I mean, it's not really like that great of a shout out because it's not like we want to have this anyways. So I'm going to see if anybody hops on. Guys, give me some hearts, some likes, anything whenever you hop on so I know people are on. I'm going to talk to you guys about signs and symptoms of PCOS and what I think is contributing to the issue. And if you don't have PCOS, why you should give a shit, because I think there's things that we're doing as women every single day that's causing hormone imbalance, and it's causing issues like PCOS in us. So I'm going to talk to you guys about that today because I think it's super important that people are aware. Thank you guys for hopping on. Hey girls, sister girl diaries, TIU Kristen, Amber. Hey guys, thanks for hopping on. I'm going to talk to you guys a little bit about PCOS today. Talk to you about, signs and symptoms, because I think the number one question I get in my inbox now, I guess because I've been doing these videos, but the number one question I get in my inbox is, hey, so I kind of think I have PCOS. How do I know for sure? And what do I do? So I get it. I totally understand, because PCOS doesn't always look like, sometimes you don't even know you have PCOS. Apparently, so many women have it. I think it's the statistic is something like 10 million people worldwide have PCOS, and half of them don't even know they have PCOS. 1 in 5 women in the United States have PCOS, and probably half of them don't even know they have PCOS until they try to lose weight or get pregnant or something like that. So I'm going to talk to you guys about that. But thank you guys for hopping on. Thank you for joining me. I'm so excited to talk to you guys about this. So, signs and symptoms of PCOS. Let's talk about it. So, one of the number one things, first of all, let me just give you a little bit of my backstory. When I went in and found out I had PCOS, I wasn't coming in for PCOS at all. I had no idea I had a hormone imbalance. I came in because I could not lose weight no matter what I did. I was being so perfect with my diet. I was being so perfect with my workouts. I was like, why am I not losing weight? Why am I gaining weight? I should not be gaining weight with how perfect I am with my diet and my nutrition, and this sucks. I don't know what's going on. So I went in, I was like, maybe I have a thyroid problem. I don't know. My doctor was like, well, let's find out or whatever. So I had my son, so obviously I didn't think I was infertile, but we're going to get into that. So anyways, after tests and everything else, and then I finally had an ultrasound, I found out I had PCOS. And then my doctor decided to put me on a bunch of medications, a bunch of supplements, a bunch of vitamins even. We were trying to have a baby. So I started doing fertility treatments, and I gained 15 pounds in 2 weeks. So imagine I'm already irritated with my weight. I'm trying to lose weight, and then I get on all these supplements and all this stuff or whatever, and I gain 15 pounds in 2 weeks. Talk about frustrating. It's the most frustrating thing on the planet. So I went off of everything. I started acting like a detective when it came to my body. I started doing research. I dug into trying to figure out what PCOS was, how to fix it, and I was able to lose the weight and deal with a lot of my PCOS symptoms that I was having. First of all, you can't be healed from PCOS, but I was able to deal with a lot of the PCOS symptoms like acne and stuff like that, the holistic route. And then I was even able to get pregnant. So when pregnancy is very, 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 very hard, for even getting pregnant and maintaining a pregnancy is extremely hard for people with PCOS. And I was able to do it, 38 weeks pregnant. So it obviously worked for me. So I'm going to talk to you guys a little bit about signs and symptoms and why you should give a shit. So signs and symptoms of PCOS. Number one is if you're trying to lose weight and you're not having any success with it. And that's not saying following a 60-40 lifestyle. That means you're being on top of it, you're doing everything you're supposed to be doing and it's not working. Or you're gaining weight and you're just what the hell? I don't understand. That was one of the number one signs with me. Number two is if you're losing hair. If you're losing a lot of hair, like a man would or whatever, or after you have a pregnancy or something like that, if you're losing that just on a regular basis and you're losing hair a lot, That might be a sign that you have PCOS. Another thing is hair in places that normally women don't have hair in places, like on our face. That's disgusting. I'm gonna talk about it but it's gross. I get it, I understand, but that's a sign of PCOS. Another sign of PCOS is not having periods or having irregular periods. It's because your body's not ovulating, which sucks, aka why you can't get pregnant. Can't get pregnant if you're not releasing eggs, right? So another thing is the acne. That's gross, disgusting. I'm gonna talk about it, sorry. But acne, especially in this area, like your chin, your cheeks, like this area is hormonal acne. So if you're getting acne here and you're using like Fields or you're using stuff over the counter or whatever and nothing's working, you probably have PCOS. Or if you don't have PCOS, like especially if you have acne here, you have a hormone problem. I'm sorry. Hate to break it to you, but you have something wrong with your hormones because this is hormonal acne, 100%, especially that cystic acne. It's gross, but that's what it is. Another thing is aggression, irritability, exhaustion, which, I mean, those could be signs of anything, but it also goes along with PCOS. So those are the signs and symptoms of PCOS. The biggest thing though is if you're not having regular periods or you're having irregular periods, that's a huge sign you have PCOS. So what can you do about it? If you think you have PCOS, you need to go to your doctor, 100%. Like, a regular doctor can run the tests that need to be tested and then you can go from there. But like even just going to your regular practitioner or your OBGYN and saying, hey, I think I have, a hormone problem. Can you test me for PCOS or whatever? First of all, she needs to be testing you for 3 things. She needs to be testing you for your insulin. She needs to test you for your progesterone levels. And she needs to test you for your testosterone, because in PCOS, you're gonna have a higher level of testosterone, you're gonna have a lower level of progesterone, and your insulin levels will probably be off too. Not always, insulin isn't a huge indicator, but you can have insulin, or you can have PCOS without insulin resistance. It's rare, but it can happen. Insulin will normally be off, you'll have a higher level of insulin. So those are the 3 things to test for. 100% though, if you want to know for sure if you have PCOS, is to get an ultrasound, because you need to see if your ovaries have cysts on them. You can have PCOS without having cystic ovaries. I honestly think that's just like an early sign of PCOS, is if you don't have the cysts yet, because at some point I think you're gonna get them. It's just kind of how our bodies work. But if you don't have cysts yet on your ovaries, you can still have PCOS, but 100% if you have cysts on your ovaries, then you know for sure you have PCOS. Like there's no doubting it, nothing, like you have PCOS. So definitely go to the doctor and get those tests done. So I'm gonna talk to you about why you should give a shit if you don't have PCOS, because I'm sure there's people who are watching this and they may have popped off already or whatever, like jumped off, like I don't care, I don't have PCOS. So this is the thing. A lot of people have PCOS and they have no idea they have PCOS. So when you have PCOS and you're not ovulating or having a period or anything like this, a lot of issues can happen in your body. If you're not having a regular period, you can cause so many issues in your body. You can cause cancer in your body from not having a regular period. So it's a big deal to have a regular cycle. I know this is gross. If there's any men on here, I'm so sorry. This is obviously not geared towards you. Thank you for watching, but this is obviously geared towards my girls. Anyways, so again, you should care, because also as a woman, if you have a daughter, you should 100% care if you have a hormone problem, because PCOS, even if you don't have signs now, or you don't know for sure now, if you have PCOS and you have a daughter, your daughter is 7 to 10 times more likely to have PCOS too, which is shocking to me. They think genetics plays a small part in it, but just the fact that if you have a daughter, she's 7 to 10 times more likely, like I'm about to have a daughter, and she's 7 to 10 times more likely to have PCOS. That sucks. I don't want that for her. Like, I know how much it sucks, and I don't want that for her. So definitely making sure that your hormones are on track and you're balanced and your body is working the way it is supposed to and efficiently will help like any of your future generations, your daughters, to not have this as well. So I think it's important that even if you don't have PCOS, if you don't have the signs and symptoms, you're not trying to have a baby, that you're aware of this, just so that you can be proactive and you can make sure that your body's operating the way it's supposed to. Another thing I'm going to talk about, but this is so controversial, People don't like it when I talk about this, especially doctors. Doctors don't like it when I talk about this, but I'm going to be straight up real with y'all. One of the reasons, and if you do the research, and if you've done the research like I have, because I'm not playing, like I didn't just read one article and talk to you guys about PCOS. I've done years of research. I'm a certified hormone therapy and hormone health coach because I have PCOS, and I was so determined to help women the holistic way, the natural way, because the medical way completely screwed me up. So I'm super passionate about this. I've done a ton of research. I've dug in. I've been a detective when it comes to my own body, helping other people. So I kind of feel like I know what I'm talking about a little bit. But the research shows that if you have been using consistent birth control, that you are completely screwing up your hormones. And it's if you look at all of the hormone issues in people's bodies and women's bodies, one of the number one thing it says could be a cause of this is regular use of birth control. And I mean, if you think about it, like let's be honest. Like if you're sitting down thinking about like hormonal birth control, what is it? It's a synthetic hormone that you're putting inside your body that your body thinks is a real hormone. So of course it's going to adjust in accordance to whatever you're putting in your body. So if you're doing it for a certain amount of time, what's going to happen? Your body's going to get dependent on it, right? So it's like, when you go off of it, what do you think is going to happen to your body? It's going to lose its shit. It's going to lose its mind, right? Like it's not going to operate the way it's supposed to. It's going to be like, hey, where's this hormone you've been putting in your body? Like I stopped making that a while ago because I didn't need to. So hello, help me. And the problem is like some people's bodies bounce back. That's fine. A lot of us don't. And that's why so many women are finding out that they have hormone problems, or they're having so bad PMS symptoms, or they're finding out they have endometriosis, or they're having a really hard time getting pregnant, or they're having infertility issues, or they're having, PCOS. PCOS wasn't a thing back in the day. Like, do you realize that? Like, it's literally like a generational thing. Like so many women have PCOS now. Like my age women in their 20s and 30s have PCOS. And it's like, think about it. What was everyone doing when they were like 19 years old? Getting on birth control. Every single person like I know when they turned 19, went off to college, whatever, got on birth control, and they've been taking it ever since. And now here we are, 29, 30 years old trying to get pregnant. And we're like, wait, why isn't it working for us? It's because doctors prescribed birth control like candy back then. Like it was like, oh, you have acne? Birth control. Oh, you have bad cramps? Birth control. Everyone with their mom got on birth control back in the day. And I honestly think it's why 1 in 5 women have a hormone problem now. So I think when it comes to hormonal birth control, we need to be a little bit more aware of what we're doing to our bodies instead of just like popping a pill and just calling it a day. I think there's other options if you're trying not to get pregnant, or you're trying to deal with acne, or you're trying to deal with, PMS symptoms that you can do instead of just popping birth control. And my advice to anyone, yes, boo birth control, Andy, 100%. If you are finding that you have a hormone problem, or you want to get pregnant in the next couple years, or you are struggling with PMS symptoms or whatever, or you're having these signs and symptoms of a hormone problem in general, get off birth control. Please just get off birth control. That's like my number one piece of advice to people. Just stop it. Stop taking it. Do whatever you have to do. I'm not getting into the nitty gritty of like how to not have a baby, but you can figure it out. Like you're smart. You're a smart girl. You can do it. Birth control is not worth it. So that's just my opinion. So I hope this was helpful, you guys. I'm super passionate about helping people. I think the number one question I have been asked in the last couple of months is like, hey, I think I have PCOS. How do I know for sure? And what do I do about it? So I hope this video was helpful for those people. And if you guys have any questions about, birth control or hormone problems or PCOS or anything like that, feel free to reach out to me. I'm always here to help or offer advice. It's what I'm crazy passionate about. But other than that, you guys, I hope you enjoyed this video. Thank you for hopping on, and I will talk to you guys next time. Bye, guys.